Welcome to Medical Specialist Associates' educational series on topics in pain medicine. I'm Christopher Voss, MD, MS, FCCP, board-certified in anesthesiology, pain medicine, and addiction medicine. Today, we're going to delve into the science behind PRP therapy, explore what the latest research says about its effectiveness, and discuss the conditions it is most commonly used for. This program is designed to provide a thorough, evidence-based understanding of PRP therapy, empowering you to make informed decisions about your health. What is platelet-rich plasma? Platelet-rich plasma, PRP, is a component of blood that is rich in platelets, which are small disc-shaped cell fragments that play a critical role in the body's healing processes. When tissues are injured, platelets release growth factors and cytokines that initiate and regulate the repair process. PRP therapy involves concentrating these platelets from a patient's own blood and injecting them into areas of tissue damage or inflammation to enhance and accelerate the natural healing process. How PRP therapy works. A deep dive into the science. 1. Blood collection and preparation. The process begins with the collection of a small volume of the patient's blood, typically around 15 to 50 milliliters, depending on the treatment area and the required PRP concentration. The blood is then placed in a centrifuge, which spins at high speeds to separate its components based on their density. This process typically takes about 10 to 15 minutes and results in the stratification of blood into 3 layers. Red blood cells, the densest component, which settles at the bottom. Platelet-poor plasma, the least dense component, which floats at the top. Platelet-rich plasma, the middle layer containing a high concentration of platelets suspended in plasma. 2. Platelet activation and injection. The PRP layer is carefully extracted and may undergo further processing to increase platelet concentration. In some protocols, the PRP is activated by adding thrombin or calcium chloride to release growth factors before injection. The PRP is then injected directly into the targeted tissue, such as a damaged tendon, ligament, joint, or muscle. The use of ultrasound guidance is common to ensure precise delivery of PRP to the affected area. Upon injection, the platelets become activated and release a cascade of growth factors, including platelet-derived growth factor, transforming growth factor beta, vascular endothelial growth factor, and epidermal growth factor. These molecules play critical roles in cellular processes such as proliferation, chemotaxis, angiogenesis, and extracellular matrix synthesis. 3. Biological mechanisms. Growth factor release. The growth factors released from activated platelets interact with local cells at the injury site. These interactions stimulate cellular activities such as the recruitment of reparative cells, proliferation of fibroblasts, and synthesis of collagen and extracellular matrix proteins. Angiogenesis. Vascular endothelial growth factor, a potent angiogenic factor, promotes the formation of new blood vessels, which enhances blood supply to the damaged tissue, improving oxygen and nutrient delivery necessary for tissue repair. Inflammation modulation. PRP contains bioactive proteins that can modulate inflammation. By reducing pro-inflammatory cytokines and increasing anti-inflammatory mediators, PRP may help mitigate chronic inflammation that impairs healing. Tissue regeneration. The combined effects of these biological mechanisms lead to the regeneration of damaged tissues, reduction of pain, and improvement in function. What does the research say? PRP therapy has been extensively studied across various medical fields, particularly in orthopedics, sports medicine, and dermatology. However, the evidence for its effectiveness varies depending on the condition being treated. Below, we'll explore the research findings in greater detail. 1. Chronic wounds and ulcers. Diabetic foot ulcers. PRP has been studied for its potential to accelerate healing in chronic wounds, including diabetic foot ulcers. Some studies suggest that PRP can promote wound closure and reduce healing time, possibly due to its ability to enhance angiogenesis and tissue regeneration. This application is particularly valuable for patients with diabetes who are at risk for non-healing ulcers and subsequent complications such as infections and amputations. Venous leg ulcers. Similar to diabetic foot ulcers, venous leg ulcers have also been treated with PRP. Research indicates that PRP may improve healing outcomes in these cases, although more robust clinical trials are needed to establish its efficacy compared to standard wound care treatments. 2. Spine conditions. Degenerative disc disease. PRP injections are being explored as a treatment for chronic low back pain associated with degenerative disc disease. The idea is that PRP could help regenerate the intervertebral disc tissue and reduce inflammation. Some early studies show promising results, though larger clinical trials are necessary to confirm these findings. Facet joint pain. PRP is also being used in the management of chronic facet joint pain in the spine. While traditional treatments involve corticosteroid injections, PRP offers a potential regenerative approach, with some studies indicating pain relief and improved function in patients with chronic spinal pain. 3. Osteoarthritis. PRP has been studied as a treatment option for osteoarthritis, particularly in the knee. Multiple randomized controlled trials, RCTs, have investigated its efficacy compared to placebo and other treatments like hyaluronic acid. A 2016 meta-analysis of RCTs concluded that PRP injections significantly reduced pain and improved joint function in patients with knee osteoarthritis, with effects lasting up to 12 months. The mechanism is thought to involve the anti-inflammatory and anabolic effects of growth factors, which may slow cartilage degradation and promote tissue repair. Notably, the quality of PRP preparation, leukocyte-rich versus leukocyte-poor PRP, and the injection protocol, single versus multiple injections, appear to influence outcomes, with leukocyte-poor PRP showing more consistent benefits due to its reduced inflammatory potential. 4. Tendinopathies. PRP has been widely used for chronic tendinopathies, including conditions such as lateral epicondylitis, tennis elbow, patellar tendinitis, and Achilles tendinopathy. The rationale for PRP use in these conditions is based on its ability to stimulate tendon healing and reduce inflammation. A landmark study by Pierboom et al. 2010 demonstrated that PRP was superior to corticosteroid injections in treating tennis elbow, with patients experiencing greater pain relief and functional improvement at both 6 and 12 months post-treatment. However, systematic reviews have shown mixed results, with some studies reporting no significant difference between PRP and placebo or other treatments. These discrepancies may be due to variations in PRP preparation, dosing, and patient selection criteria. 5. Rotator cuff and shoulder injuries. PRP therapy has also been investigated for the treatment of rotator cuff injuries and other shoulder-related conditions. These injuries often involve partial tears or inflammation of the rotator cuff tendons, leading to pain and reduced shoulder function. Research suggests that PRP may enhance the healing of rotator cuff tendons when used as an adjunct to physical therapy or surgical repair. A study published in the American Journal of Sports Medicine found that patients who received PRP injections during rotator cuff surgery had improved tendon healing and reduced pain compared to those who did not receive PRP. However, as with other tendinopathies, the outcomes of PRP treatment for rotator cuff injuries are variable, with some studies showing limited or no additional benefit. Further research is needed to determine the optimal PRP protocol and patient selection criteria for these injuries. 6. Chronic plantar fasciitis. Chronic plantar fasciitis, a common cause of heel pain, is another condition where PRP therapy has been explored. This condition involves inflammation of the plantar fascia, a thick band of tissue that runs along the bottom of the foot. Several studies have shown that PRP injections can provide significant pain relief for patients with chronic plantar fasciitis, particularly those who have not responded to conservative treatments like physical therapy, orthotics, or corticosteroid injections. The growth factors in PRP are believed to promote tissue repair and reduce inflammation in the plantar fascia. A randomized controlled trial comparing PRP to corticosteroid injections found that PRP resulted in greater long-term pain reduction and improved function, with fewer adverse effects. However, as with other conditions, the effectiveness of PRP for plantar fasciitis can vary based on individual patient factors and the specific PRP preparation used. 7. Acute muscle injuries. PRP has been explored as a treatment for acute muscle injuries, such as hamstring and quadriceps strains. The hypothesis is that the growth factors in PRP can expedite the healing of muscle fibers and reduce recovery time. A study published in the New England Journal of Medicine in 2014 reported that PRP injections accelerated the recovery of professional athletes with acute hamstring injuries, allowing them to return to play more quickly than those treated with standard care. Despite these findings, other studies have failed to demonstrate a significant benefit of PRP over placebo in muscle injury recovery, highlighting the need for further research to identify the factors that contribute to successful outcomes. 8. Ligament and meniscal injuries. PRP is also used in the treatment of ligament injuries, such as partial anterior cruciate ligament, ACL, tears, and meniscal injuries. The goal is to enhance the healing of these avascular tissues, which typically have limited regenerative capacity. Studies have shown that PRP may improve the healing of ACL grafts and meniscal repairs when used as an adjunct to surgical reconstruction. The proposed mechanism involves the stimulation of collagen synthesis and the enhancement of graft integration. However, the evidence is still evolving, and long-term studies are needed to determine the durability of PRP's effects in these contexts. 9. Dermatology and aesthetics. PRP has gained popularity in dermatology for its use in facial rejuvenation and hair restoration. The growth factors in PRP are believed to stimulate collagen production and enhance skin elasticity, leading to a more youthful appearance. In hair restoration, PRP is used to treat androgenetic alopecia by promoting hair follicle regeneration. Several studies have reported increased hair density and thickness following PRP treatments, although the exact mechanisms remain under investigation. 10. Orthobiologics and regenerative medicine. Combination therapies. PRP is increasingly being combined with other orthobiologic treatments, such as stem cell therapy or hyaluronic acid injections, to enhance therapeutic outcomes. This approach is particularly relevant in orthopedics, where combining PRP with mesenchymal stem cells has shown promise in treating cartilage defects and improving joint function. Cartilage repair. In orthobiologics, PRP is often used alongside stem cells or scaffolds to enhance cartilage repair. This combination has been explored in the treatment of conditions like osteochondral lesions and early-stage osteoarthritis, where the goal is to regenerate damaged cartilage and improve joint function. Early studies suggest that this combination may improve clinical outcomes, although more research is needed to confirm its long-term effectiveness. 11. Limitations and considerations. While PRP therapy shows promise, it is not without limitations. The variability in PRP preparation methods, platelet concentrations, and patient responses makes it challenging to standardize treatment protocols. Additionally, PRP is not FDA approved for all applications, and insurance coverage for PRP therapy is often limited. Who might benefit from PRP therapy? PRP therapy may be particularly beneficial for patients who have not responded adequately to conservative treatments, such as physical therapy or anti-inflammatory medications, are seeking a minimally invasive option with a lower risk profile compared to surgical interventions, prefer a natural autologous treatment approach that harnesses their body's own healing mechanisms. While the science behind PRP is compelling, its effectiveness varies depending on the condition being treated and the specific protocols used. Patients considering PRP therapy should have a thorough discussion with their healthcare provider to ensure that the treatment aligns with their individual needs and goals. As with any medical treatment, a personalized, evidence-based approach is crucial for achieving the best outcomes. To learn more about pain medicine, please visit us on our website at medspecialists.net and subscribe to our YouTube channel.